What's up, guys? Welcome back to Worth the Wait. I am your host, Cookie Miller, and I cannot even explain how excited and honored I am to have the guest that we have today. You guys, we have the epitome of Black girl magic blessing us with her presence today. Dr. Erika Simpson is here. She is an OB-GYN. And before we started recording, we were talking about the fact that I've never even had a Black OB-GYN. So we're going to get all into all the details. But first, I want Dr. Erika to give us a little bit of background. Tell us how you got into the field. Tell us a little bit about yourself.
Awesome. Well, first, thank you for having me. This is like a big deal for me too. So I am a Southern California born and raised native. I'm a sunshine girl. I born and raised Southern California. I went to college at an HBCU. So I went to Tuskegee University. And I spent a great time in Alabama. And then I went to another HBCU for med school. I went to Meharry Medical College, which was one of my absolute dreams, to be able to be around a bunch of super educated, intelligent badasses, like brown badasses like me. And I did my residency training in Northern California in Oakland. I wanted to be in another really diverse city around a bunch of Black and brown doctors and patients. And then I worked in Northern California for about 3 years after I graduated from residency, and then came to Southern California back home when I decided to start a family and needed to be closer to home. So I've been here for now almost 8 years. I did not think I wanted to be an OB-GYN. Like a lot of OB-GYNs, we typically think we're going to do something else. So I thought I was going to be a pediatrician because I love kids. And I took care of my first couple of sick kids. And I was like, no, thank you. I like happy babies. I like happy children. I don't want sick kids. I'm too much of a softie for that. So I kind of went through med school training, not knowing what I was going to do. And then I delivered my first baby. And I cried, the dad cried, everybody cried. And I delivered my second baby and I cried and everybody cried. And after my third baby, I called my mom and said, Mom, I'm going to be a vagina doctor. I'm going to take care of ladies. And here I am.
Here you are. And I was, of course, stalking your IG and I heard you tell this story. Mm-hmm. And I went, you know what? I knew there was just something about her that I loved. But when you told the story about how you tried to work with the kids, it made me think about my time volunteering. I volunteered at Texas Children's Hospital very briefly as a patient pal. Listen, because when I walked in that room, I mean, the emotion that came over me was like, okay, like I'm going to try to do this. And then like I met like a teenage kid who was in there and that like freaked me out. And then the first baby I saw hooked up to all these machines, I was like, I'm so sorry, but I can't do it. Like,
and even on the hospital setting side, like when you're like the person who's supposed to be taking care of them, right? Like we're supposed to have this, we can do this. And I had the exact same feeling. Like I can't, like not young kids, young adults, young babies, like, no, thank you. No, thank you.
It's tough. You know, some people, obviously we have incredible medical teams and even volunteers who can do it. They have the capacity to do it. Yeah. I have a friend who is a pharmacist and she's also a chaplain at a hospital and she can do it. And I'm like, go girl.
Yeah, my younger sister is a NICU nurse and she takes care of the smallest of the smallest. So like less than 1 pounders, like, and she deals with a lot of death and dying in the NICU because of babies that don't make it. And she can do it. She's got the personality and the, what I call the emotional hardness, where that she can take care of those babies, take care of those families, get them through a insanely tough journey and still walk through life and be okay. And it is much harder for me to do that. I like being on the other side of things. We all have our lanes. We all have our things that have got talents.
Exactly. So, okay, let's lighten it up a bit because one of the things that I love about just seeing your presence on social media is how fun and funny you make the topics of so many different things, such as like menopause and talking about sexual health and all these things. So as we get started, I want you to share with us like maybe one of the funniest or most surprising stories you have from your career thus far.
I would say, and this is like, this was funny, but I feel like it was a learning opportunity for me, that I had to remember that, like, just because I do something every day and something is very common and commonplace for me, that it's not for someone else. So I'm in my office, I'm seeing my patients like normal. And I have a patient who's coming in for her first ever exam. Never been to a gynecologist before, here for the first time. And my nurse does her typical routine, which is like, hey, what are you here for? Do you have any concerns? And then says, okay, great. The doctor will be in to see you shortly. Please get undressed. Here's your gown, and walks out. I walk into the room. I usually give patients, a few minutes to get undressed. I walk in the room, and this poor young woman was sitting in the room completely naked on the bed, trying to cover herself, right? And I'm like, ma'am, where's your gown? And she was like, I didn't hear her say put on a gown. And I'm like, this is really uncomfortable. And I'm like, of course, like, you're sitting in this exam room completely naked. The door doesn't lock. No, like, anybody can walk in here. And I just remembered, like, it helped. It was funny. And she thankfully, like, laughed it off. We gave her a gown. She was fine. But I remember being like, we have to be very purposeful, right? Like, purposeful in that I need to be specific. Please put on a gown. You do not need to be naked in this room. This is already a very vulnerable space. And we need to make it the least vulnerable possible. And I've even switched even further from that. So I used to have all patients get undressed, and now I don't. I actually go into the room, talk to them first, and then say, hey, is it okay to do an exam? Now let's have you get undressed. And I'm waist down, gown front, no nakedness. You do not need to be completely naked in here.
Oh my gosh. She must have been in there thinking like, this is why I've never done one of these. Like, exactly. I didn't know what to expect. And like, what the heck is this?
I can imagine her going home and being like, girls, ladies, friends, don't do it. Don't do it. You're going to be naked. It just, it was very, and it's something so simple, but it was very like, it was a reminder, this is a vulnerable space, and people come here and they're open and transparent with me, not only like emotionally and communicatingly, but just physically. And so we need to be mindful of that.
Yeah. Well, wow. That's a really funny one.
Yeah.
I noticed that a lot of what you talk about is really more so related to sexual health, which also, ding, 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 like that's not something that we see a lot of, period, across the board. And then especially just coming from just being Black or being a person of color. So in your practice, are there any common myths or misconceptions that you tend to encounter, and what are they?
There are a number, and so I won't bore you with all of them. But I think the very first that, and kind of ties into that story, is just because you come to a gynecologist does not mean that you need to be examined. So for a lot of younger adults, or even teenagers who, let's say they have questions about their sexuality, or they have questions about their overall health in general, pregnancy or whatever, and they just want to ask questions, a lot of them don't come to gynecologists because their assumption is, I'm going to have to get naked. I'm going to have somebody touch me. And all I want to do is ask questions. So just because you come to us or to our office doesn't mean that you have to be examined. You can come and ask questions and get information. And then if an exam is needed, you get to say when and how that exam happens. So I think that's a big one that I try to remind people a lot, because we want you to come see us. We want you to ask us the questions that you want to ask. We want you to get the information from the right place. We don't want you to feel like in order for you to get that, you've got to give us something, because that's just not the case.
Right.
Yeah, I think the other big one is surrounding STIs. So STIs, sexually transmitted infections. A lot of people think if they come to any doctor's office and they have an STI, that we are obligated to tell everybody and their mama, okay? That we're obligated to tell them, their family, their friends, the people who are sleeping with. We are not. There are certain ones that are required to be reported to the state because they keep track of those types of infections. But I am not obligated to call your partner and say, hey, so just so you know.
Mm-hmm.
Erika got this thing that you might want to talk to her about. Like, that's not my job. My job is to take care of you and to make sure that you're taken care of. In certain situations, I can offer treatment for your partners, but my job is not to blast your business. That's not my job. My job is to take care of you.
Right. I'm glad that you pointed that one out, because I think a lot of people maybe just steer away from even coming in at all or even being tested at all and not even knowing themselves, because it's like, if I don't know, I don't have to tell anybody, you know, type of thing. So I'm glad that you clarified that.
Yeah.
I want to switch gears a little bit. And this is, of course, my bias, because as you know, I've had a weight loss journey. So my weight loss journey, I've lost about 100 pounds this year. I can't remember. I think this year is the 10th year or maybe the 9th. I feel like that should be a bigger deal, but this month marks my fitversary, and therefore a lot of my audience is following me because of weight loss and wanting to learn more about weight loss. So I'm wondering, from your perspective, what advice do you have to women, specifically women over 30, in terms of navigating their weight loss amidst maybe some hormonal changes? So not necessarily getting into perimenopause yet or even menopause, but we still are having hormonal changes as we get older.
Yeah. I think that I get this question a lot, just about how, you know, as I'm getting older, like, things are harder and how do I navigate those things? Number one, it is real. The older that we get, our body does change. And so weight loss is harder, weight gain is easier. And so we have to very, very much be mindful about the things that we're doing, intentional about what we eat, intentional about how we move our bodies and things like that. But we also need to understand that with our normal menstrual cycle, we have hormonal fluctuations that can impact lots of different things, but including our metabolism and the way that we feel about ourselves and just all of those things. And so a lot of women, when they come to me and they say, hey, like, I'm having my normal cycle or I'm having these hormonal fluctuations and I just feel like things are so hard. I try to encourage them to focus on the times during the month that things aren't hard. So without getting too sciencey, right? We do have normal hormonal fluctuations that happen to help us prepare for either pregnancy or our menstrual cycle. And those things happen, as they happen, they are typically short, meaning that they happen over the course of 24 or 48 hours. And then they kind of progress to the next phase, right? So despite how we feel that we feel when we're having these hormonal fluctuations that we're struggling, it is a very short period of time that our hormones are actually doing a lot of this. So try to focus less on the days that you feel like your hormones are fluctuating and focus more on the days that you feel good and have more control over intentionally what's happening. So yes, our hormones do fluctuate. Our bodies do get harder to control as we get older, if that's a good way to put it. But we can still be very intentional and still have the results that we're looking for despite what our hormones are doing. And I say all that, like, taking out the people who have true hormonal dysfunction, like PCOS and endometriosis, things like that. We're talking about just in general, women who are having normal, healthy menstrual cycles, that are going through life normally, don't have any significant health problems. Typically, we can get around those hormonal fluctuations because they are short-lived for short periods of time.
Yeah. And, you know, I was one of those people that just, listen, forgive me. I was in my 20s. I had no idea. I had done the thing, lost the weight. I have endometriosis. So I did deal with the hormonal imbalance and all of that. I also had insulin resistance. So there was a lot going on there. But even still, there's something about just being a younger person that in your mind just makes you think, there's no excuse. Nothing's going to change. Like, it's fine. You're not doing the thing. So if you scroll back on my IG, you know, I don't delete those things because it's like, you guys got to see the growth.
Right. That's the learning curve.
I was one of those people going, hey, older ladies, you just need to get up and get in the gym. And I hit that 30 mark and was like, my bad.
Yeah. It almost becomes where you do have to be even a little bit more stringent about how much exercise you're doing, what you're putting into your mouth, and how those things that you're putting into your body are making you feel. You have to pay more attention to your joints. You have to pay more attention to how your back feels and what you're doing. Like, it is, there are subtle changes that happen, especially and happen, and as we age, become more and more important. But I never like for women to feel like, oh, I can't lose weight because of my hormones, especially not endometriosis, not PCOS, not women that are dealing with that, but my young, healthy ladies were like, I just can't do it. And I'm like, okay, hold on. Let's take a really good deep dive. I'm someone who also has struggled with weight. I was at one point in my life where I was 250 pounds. I lost 50 pounds. Went on to lose another 50 or 40 or 50 more, had 2 babies, need to lose some more weight, and deal with all the hormonal fluctuations that happen with that as well. So I understand the struggle. I've been there too. I thankfully haven't had PCOS or endometriosis and had to deal with the complications of that. But I understand that as we age, things get a little bit harder, but they're still very much doable. And so I don't want people to feel discouraged, you know?
Right. For sure. I mean, like I have so many women that I work with that are in various stages of, their phases. I have women in perimenopause, women in menopause, it's just, you have to go at it a little bit differently, but it's definitely not impossible. I will say that what I've noticed is that if you can get a hold of it sooner rather than later, it makes it so much easier.
It does. And I feel like that's true of like just habits in general, right? The longer you've been doing a habit or a routine, the easier it is for you to do. As I've gotten well into my 40s, I've definitely noticed that you do. I have to even be more intentional about not only what I'm putting in my body, but how much of that, and combining that, or I guess comparing that with also how much activity I'm doing, right? So I can eat maybe a little bit, have a little bit bigger slice of cake when I know I've been active that week. But if I haven't been active because things going on, if I haven't been able to really be intentional about what I've been putting in my mouth, then it is easier for me to put on pounds. It's actually not fair when you think about it, right? Like it's so hard to lose, right? Period. But definitely as we get older, it's so hard to lose. But then it's so easy to put on that 5 pounds.
Like that.
They're like, I just went on vacation. I just had a margarita. Wow. Okay.
Yeah. It's like that. I posted the other day about like walking around at the mall, and I'm like, if you want to be able to maintain your weight a lot of women come to me and they say, I want to be at my high school weight or my college weight. First of all, I think that's a little cray, depending. And I think that we need to better understand body composition, fat versus muscle mass, and what your body is going to look like and feel like if you are strong versus just naturally kind of being thinner because you're younger and you're more active. Right. But the whole point of the post was like, if you want to be doing those things, you have to do what you were doing in high school and in college. And when we were younger, we were going to the mall, walking laps. For nothing, for no reason, We
had PE every day, right? Like I think about like my nephew right now. So I have a 14-year-old nephew who I adore. He is 6 foot, whatever. He's hugely tall, but like this big, right? And he eats like a horse. I think partly because he's a guy and genetics, right? Men. But when I think about him, he plays basketball. He has basketball practice 6 days a week for 2 to 3 hours a day. Right. So he'll never put on weight as long as he does that. And so people often are like, oh my God, you don't feed him enough. No, he eats like a horse, but he also exerts himself fully every day for multiple hours. And that's what you can do when you don't have bills or kids or a job. Right. But the same thing goes for us, right? Just like you said, we cannot expect to be 125 pounds like we were, as the flyer on our cheerleading squad at 45, when we don't practice every day, we don't exercise every day. We are not very careful about what we put in our mouths. We're sedentary. We're driving an hour to work. Like there's so many things that we have added to our lives that we didn't have to do when we were teenagers and young adults. Like it's different. Yeah. The common, when I'm talking about changes in sexuality as we age, one of the common things I say is sex at 20 and 30 is different than sex at 90. It's still sex. It can still be enjoyable and pleasurable, but our bodies are different. And so how do we adjust for that change in our bodies? And the same can be said about weight loss and diet and just taking good care of our bodies. How we do that looks different depending on what age and where we are in our phase of life.
Right, exactly. And I'm glad that you brought up sexual health because that's something that I want to talk about as well. It's just like when we're talking about maintaining our bodies and being healthy, the act of sex itself is an activity, right?
It's
exercise. It's always funny when I see my clients, they wear their watches and I see these little peaks overnight and I'm like, she was getting her cardio in.
Hey, whatever way you gotta do it counts.
It does. It absolutely counts. So can you share some tips for just maintaining a balanced lifestyle, which might also help to benefit sexual health and just overall well-being?
Yeah, I think what you do, what your whole platform is based on, is a great place to start. But just make sure that we're taking good care of our bodies and taking good care of ourselves. And that doesn't mean that you have to be a certain size, certain shape, certain dress size, or anything like that. But prioritizing your overall health. Research proves to us that people who take care of themselves have better sex. Period. And that doesn't mean that you're a size 2, right? That just means you're somebody who takes pride in making sure that you are okay physically, emotionally, and sexually. So making sure that we're prioritizing ourselves mentally, emotionally, physically, so that we can take good care of ourselves. Taking care of your body is part of that. So making sure that you're maintaining a healthy lifestyle, eating well, being very intentional, exercising regularly, which sex can be a part of. And that tends to bleed over into your sexual life. And you tend to be happier sexually when you're taking good care of yourself.
You're helping me right now. You know what I mean? Listen, so ladies, I feel like maybe that's the approach I need to come from, because if it's like, listen, if you get yourself nice and healthy, you're going to have a bomb sex life. I feel like that might be, you might create a little lane there.
And it doesn't even need to be like your sex life is better with another person. Your sex life could just be better, just period, right?
Yeah.
When you feel better and you feel better in the way that you look, the way that you take care of yourself, your diabetes is under control, girl. You're on less medications. You are, you're running a mile, you're walking a mile now, like you're doing the things. Then sexually, you are much more confident because you're like, I can do this. It bleeds over into so many aspects of our life. So taking care of ourselves should be the priority really at all times.
Yeah. Yeah. Okay. So I know that we kind of talked about hormone imbalance. I want to talk about it a little bit more. I know that a ton of people who follow me have some form of hormone imbalance, especially when we're talking about women of color. We definitely struggle with PCOS a lot more than other races. And it's a roller coaster. I get it. Like I said, I have endometriosis. So can you share some insights into managing some of these fluctuations when you have a hormonal imbalance like that?
Yeah. So I would say, if you are concerned about a hormonal imbalance or you feel like you're having symptoms of a hormonal imbalance, the first thing you need to do is talk to a healthcare provider. Make sure that you get that diagnosis or don't, or figure out what's happening so that we can better approach treatment. Because I think a lot of times, a lot of us, and especially Black and brown women, what we do is we are like, okay, this is going on, but I got life, I got stuff, I got things to do. I don't have a lot of time to be at the doctors, at the hospitals, doing all this stuff. I'm just going to make it through life. I'm not hurting necessarily. I'm not dying. My hand's not falling off. Let's just move through it. But I think it's important to make sure that you know exactly what's going on with your body. Because if you have a hormonal imbalance, there are definitely ways that we can treat that and ways that we can get you feeling better. And the only way that we're going to be able to talk to you about that is if we know what's happening. So if you feel like something's going on, most of us pay for healthcare. And even if you don't, you got it. Go see somebody. Like that's the whole point of us being here, is for us to figure out what's going on if there's something going on. So that's number one. Find somebody, talk to them about it, figure out what's going on with you so that we can figure out what's the best ways to treat you. For a lot of women with hormonal imbalance, and this is, I was contemplating on whether or not to say this out loud, but where I'm going to do this, I'm going to try and do it in a way that isn't crazy. But for a lot of people with hormonal imbalance, one of the mainstays of treatment to get your hormones back normal, and I use normal loosely, is to use some type of hormone. And I know lots of people have mixed feelings about hormones and whether they think that's okay or not and natural or not. I mean, we can have an episode about that by itself. But for a lot of people, being put on hormones on a regular basis is what will help manage a lot of the symptoms of hormonal imbalance. So that's where talking to that healthcare professional is going to be important to see if that's the right answer for you. Other ways you can do it are diet and exercise. If you have a higher weight, if you have excess fat on your body, then your body is actually naturally producing more hormones, and that can make a hormonal imbalance even more imbalanced. So sometimes naturally just reducing your weight even a little bit, that's not necessarily dropping 100 pounds, that could be dropping 10 or 15 pounds, but that could be a natural way to kind of get things back on track. So just figuring out what's wrong and then having someone lay out all of the options that are available to you, I think are super important. And then you can decide what makes the most sense for you, your lifestyle, your family, and then go from there.
Yeah, I mean, I definitely agree, and try different things. You know, I tried things, some things worked for me, you know, some things didn't. And just because something does not work for your cousin or your sister, it doesn't mean that it's not going to work for you. Everyone is so different. I think a lot of people get caught up in, you know, this is the thing that's going to work. And it's like, no, there's probably going to be a combination of things, you know, that are going to work, and that's okay.
Yeah. And I'm so glad you brought up the families, because we know that PCOS, endometriosis, and lots of other hormonal dysfunction like thyroid stuff runs in families. And I get a lot of patients who say that, hey, my mom has PCOS, my sister has PCOS, I have PCOS. This didn't work for them. I don't want to try that. And that's fine. You are 100% allowed to decide what goes into your body. But I 100% agree, just because something didn't work necessarily for a close family, it doesn't mean that it may not work for you. It may not be the best option for you for other reasons, but I think it's important to remember that we are all individuals and our bodies all function a little bit differently. And so what may work well for someone may not work well for you, and just the opposite. What didn't work well for somebody may work great for you.
Exactly. Are there any aspects of hormonal imbalance that you feel like people should be more aware of? Like when I think about this question, I think about women who maybe are not even like going to the bathroom regularly, for example. They're constipated. And when people think they're constipated, they're like, oh, let me take a laxative or let me do this or that. And it's like, we need to really get to the root of why you're chronically constipated and not have you relying on laxatives. And also understanding that when you're not having bowel movements, you're not releasing that excess hormone, right? So that could be also contributing to some of the issues that you're having. I think that's something that people don't necessarily think about. They're not thinking hormones, constipation. So is there anything else like that?
I was going to say bowel disease or bowel dysfunction often goes hand in hand with things like endometriosis and PCOS and things like that. Our bowels, in a lot of ways, and for a lot of diseases, is usually one of the first things that starts to act weird when something's not right. So I would say, in general, anything that seems a little bit off for you, we should investigate. So just like for constipation, for example, if you realize that you're taking a laxative every week, I realize not everybody is like this, but I'm super open with friends and family. That they know what I do. They know my passion project is sexual health. So there's pretty much nothing that is not dinner table conversation. Okay. So I ask questions like, hey, so like, is everybody's bowel movements good? Like we're going like at least every other day, right? Like, you know, and if you have family or people that you're comfortable with, you can ask questions like that, like, hey, like, what's this like for you? Is this normal or not normal? And typically my, viewpoint is if one person says, that's not me, that might be a good question to ask your doctor, right? Because we're all not the same. But I think if someone, if you're not using the bathroom regularly, or you're struggling to do that, if you're struggling with your periods, if you're struggling with like the other common one is pain. I have women in my family who have zero pain with their periods, like zero, like they barely know it's here, right? And then I have a sister who like she can tell you the second her period is going to start, because it's like, and there it is, like the pain begins, the cramping happens, like she can tell you. And we have a wide variety in between, right? But I remember when she started having this significant pain and her being like, yeah, like I have to call off work for a week. And I'm like, no, women are half the working force. If all of us called out for a week, we'd be in trouble, right? That's not okay. And her thought was, oh, well, I just assumed everybody had pain like this. No. So if you have friends or family that you're comfortable with and you're noticing a little something off, or just, you're just having casual conversation, be like, hey, do you do this too? And if you hear no, then it might be a question to say, hey, is this, where on the realm of normal, on the scale of normal is this? Because your healthcare provider can tell you. Like, does this sound okay or this does not sound okay?
That's really good advice. And especially to ask like more than one person, because for me, I'm growing up with my mom who also had endometriosis, which I didn't even realize growing up. So us, being at home together, having our periods and, all the pain and everything it was normal. It was like, hey, I need the heating pad, all right, I'll take the ibuprofen. It's like, this was just a normal thing. And it wasn't until really I got to college and got to kind of experience different girlfriends, and even my best friend to this day, she would just be like, oh, I didn't even know my period was here. And I'm like, what? Yeah. I mean, like mind blown. Like, are you kidding me? Like, I always know when it's coming. I feel it coming. I can feel the pain. So I think that's really great advice.
And it's hard, if especially for people who don't have someone they're comfortable with, or if they're, they're the only girl in a home full of men, right? Like they've got 5 brothers, like my mom. You don't have a person that you can be like, hey, is okay? Like, but I feel like one of the best things that social media and the internet did for us is that it allows people to have access to other people and ask questions to other people that they may not have ever met or ever come into contact with. And so if you don't have somebody that you feel comfortable saying, hey, is this the experience that you've had or that you know somebody to have, go on the internet. People will tell you if they feel like, if they're have similar symptoms to you, and then you can go to your healthcare professional and say, hey, this is what I'm experiencing. Am I crazy to think that something's wrong, or do we need to investigate this a little bit further?
Yeah, for sure. And, we've talked a lot about period health just in general. I don't want to leave my menopausal ladies out. No. I don't want to leave them out. And listen, I'm headed, I'll be there at some point. Even if you're not there, we'll all get there at some point. Yep. So I want to talk about perimenopause versus menopause. Maybe if you could even just define those different phases for us. And then, what is a significant, since it is a significant milestone in a woman's life, some tips on being able to navigate both of those phases.
So it's funny you say it like that, because I teach a class on menopause and about the different symptoms and like how to navigate some of the symptoms of it. But the quote that I use in there is that menopause is a natural health milestone. There, many, many, many years ago, women didn't even live that long, right? For us to even know about menopause, that it's a natural thing. So to get there, as crazy as it sounds, we should celebrate a little bit. You've made it to this point in your life. So I think it's important. Perimenopause and menopause, those 2 words often get interchanged and used interchangeably, and they're actually not the same thing. So menopause is when you've gone 1 full year without a period. So full 12 months, no period. That's how we know you're in menopause. You cannot have your own natural babies anymore. All of the things in your reproductive structures have now kind of shut down and closed. Perimenopause is the time, usually about 2 or 3 years before your periods stop, where you'll start to see your periods get a little weird. They may come less frequently, more frequently. They may change in flow. They may be more painful, less painful. They just get kind of weird. And you also may start to experience the symptoms of menopause: hot flashes, night sweats, insomnia, brain fog, all the things. You might start to feel all of that. And that's kind of the warning signal that women get, like, hey, menopause is coming, because we're starting to feel these things and our periods are getting a little weird. So they actually are not the same thing. Perimenopause usually starts in the mid-40s to late 40s for some women. And menopause, usually the average age is about 50 or 51. Unfortunately for our Black and brown ladies, we get everything. So we tend to experience menopause a little bit later. So it's 53, 54, 55 for some of us. So, we got to make sure we know, like, if we're still having periods and you're experiencing symptoms of menopause, you are perimenopausal. The periods is what marks the difference between the 2.
Interesting. I never really looked at it like that. Yeah. You're saying that the difference in the period is really whenever it's official, right? Yeah. Once you've gone the full year.
Yeah. I like to call perimenopause the transition, right? It's you are kind of moving into this new phase. This is kind of the beginning part of that. And once you've stopped having periods for the full year, you are now fully into menopause. So I So I personally, where I work, I do a lot of classes and a lot of education on menopause because I feel like it's the one area for women that we don't get a lot of information about. We know about it. We know it happens. We know the periods at some point stop and some of us get crazy, but we don't really have a lot of discussion around truly what's happening, why it's happening, what's normal, I guess, and then how we can deal with those things. I remember my mom, when she went through menopause, I was in medical school and I happened to be on my OB rotation while we were learning about menopause, and she just started the hot flashes and night sweats. And I remember my mom asking me about it because her mom was like, oh, we don't talk about that. Your period's just stopped. You're fine. We get through it. And I feel like there was this generation where it was like, you don't talk about it because you don't want people to think that, you're crazy or whatever. But it is there's a lot of serious things that happen during menopause. Our bodies truly change. And we don't have enough discussions around that. So if you have female family members that are old enough to go through it, then definitely asking them, what was your experience? What was your transition like? What was your experience like? What age did it happen? Because in general, female family members tend to share similar experiences, not always, but they do tend to share. So asking that, and then if you can, well before we get there. So I like to think mid-40s, we need to be when you're having your regular pap smear, your regular annual, talking to your person and being like, hey, so what should I expect? What things do I need to be concerned about that I need to call you for? Or that we need to discuss more in detail? Because I don't want people to think that they're going through it by themselves. I think the recent statistic was, I think it's like 1.2 million women go through menopause a year. So you're not by yourself when you're going through it, but it feels like it sometimes. It feels like you don't know your body anymore. I often say it's the reverse of puberty. And if you remember what having your first menstrual period was like and how that was, at least for me, devastating. I thought I was dying. I just knew that I was bleeding to death and I was going to meet my mom in heaven. And having to learn, oh, your breast being tender is normal. Oh, you're bleeding, but in this instance, it doesn't mean something dangerous. The cramping is normal, and having to learn that and then figure out what was normal for my own body. That's what happens during menopause for a lot of people. You have to relearn what's normal for your body, what's normal for you, and what things you need to be concerned about. But it can be a really difficult transition for people.
Yeah, it's tough. Like I said, I have a lot of ladies who are in either the perimenopause or menopause stage, and I work with a lot of women of color. And one thing that I notice is that a lot of the times when they have started to show signs of perimenopause or when they've reached menopause and they haven't had that period for a year, their doctors haven't discussed with them any options in terms of HRT, hormone replacement therapy. And I know there's a lot of different opinions on this, like you said before. And there's, maybe some people with a familial history of certain types of cancers and things like that maybe would not want to go into certain forms of HRT. But can you talk about some of those options? Because I think a lot of women, when they get to that point, they're like, well, I just got to deal with it. I'm here. But we have options, right?
Tons. So, again, I feel like a commercial for OB-GYNs, but I do think it's important. That's why you have to have an OB-GYN, not a family doctor, not a primary, an OB-GYN, because your primary, if they can have taken care of you for years, but they are not experts in hormone replacement and menopause and things like that. You want to have somebody who knows what they're talking about. So it's important to have somebody that you trust that also has training in hormone replacement and menopause therapy and that kind of thing. So I think it's important to know that symptoms vary from person to person. There are women out there who literally have zero symptoms. They literally wake up one day, their period never comes back, and that's it. They don't have anything else. They go through life. I call them the unicorns. They go through life and life is bright and life is great, right? And then there are women who have the extreme side of things where they are having hot flashes every 15 minutes. They have insomnia. They have brain fog. They have mood symptoms. Their sex drive changes. Everything happens to them and everything in between. So making sure that you understand kind of why things are happening to you, but then making sure that you're kind of documenting, these are the symptoms I'm experiencing. So when you go to your healthcare professional, they can say, okay, these are how we treat these specific things. when I'm doing my class on menopause, I break down things between like, what are your prescription options, like hormone replacement? And there are a variety of ways to do hormone replacement, but there are also non-hormonal medications that can be used to treat certain things like hot flashes or mood symptoms or brain fog. Like things like vaginal dryness. You don't have to take a hormone at all. You can use moisturizers, lubricants, and other things to help with vaginal dryness that comes with menopause. For insomnia, you can use a sleep aid. You don't have to use hormone replacement for that. And there are tons of over-the-counter natural herbal supplements that are also designed to help women get through some of those symptoms as well. So there are tons. You just got to talk to us. And not only talk to us, but then communicate what you're looking for, right? Because I can list the barrage of things for you, but if you know, hey, I don't want any hormone replacement. I don't like the idea of that. I've read about it. I don't want that. I want something natural and herbal. Okay, well, let's skip all that and go to the natural things or go to the non-hormonal things. So if you're not sure, then yes, come to me. I will tell you everything you ever wanted to know. But if you kind of have a direction you want to go, then let's go in that direction and not waste your time talking about things that you're not interested in using. But there are lots. There gone other days where you could only take super high dose hormones that had the risk of cancer and stroke and heart attack. We have a lot more options now than that.
I'm so glad that you said that. And it makes my heart so warm that you mentioned the herbal options, because I especially think like us as women of color, it's kind of like getting back to our roots when we start to use our herbs and like, different methods that maybe our ancestors used for pain management and for things like that. So that just makes me so happy. And I think, especially for my audience, because I am that woo-woo girl, I'm give me all the herbs. You should see my tea closet is crazy. But I think that sometimes people get a little afraid because they're like, well, if I go to a doctor, certainly they're just going to give me a medication. And that's not always the case. You just have to find the best doctor for you who understands, like you said, what you want. And you also have to say what you want and what you don't want. You got to advocate for yourself. Don't just go in there and say, hey, give me anything. And then they give you a medication and you're like, they just give medications,
Right. And I think while I I appreciate the respect that comes along with being a doctor and people coming and saying, oh, this is what you recommend, I'll take it. Sure. Right. I want all of my patients to be very comfortable with what we're doing, why we're doing it, understand it, so that when they go home, talk to their husband or their partner, they can say, oh yeah, I'm taking this because Dr. Simpson said this is going to help with this problem that I'm having, right? I don't want it to be like, oh, she just handed this to me and I'm taking it.
Right.
So I think making sure we understand why we're taking it and what it's supposed to help is important. But like you said, it's if you know I'm not comfortable with hormones or I'm not comfortable with herbal supplements for whatever reason, I want X, then let's talk about how to get X, right? There may not be a pill for everything, but if there's something out there that's available, let's talk about it and figure out if it would be best for you. And you ultimately get to make the decision. My job is to tell you the information, give you the whys and why nots of what I think might be best for you given your specific situation. But at the end of the day, I'm not going to assault you.
I needed you 10 years ago. Like, what is this? I needed you 10 years ago, girl.
You know what? I am blessed to be to be doing this type of work in a space where people are, number one, patients are looking for alternative options that aren't just give me this medication and go away. But I'm also kind of raised in okay, let's talk about all the things, like my mother says this all the time, like whenever we need a new car or whatever, my mom is like, oh, I'm very of the opinion, if I'm going to spend $40,000, I want to see every single car that is in that $40,000 range and make a decision based on after I see everything. And that's kind of how I approach medicine, right? You always have options. Now, you may not like all of the options, but you always have options. And you choose the option that works best for you. And for some people, that's nothing, right? Like menopause is not dangerous. It's not going to harm your life. It can be very disruptive. It can be very difficult, but it is usually not life-threatening. And so I have women who walk in who say, oh, my mom told me she was on hormones. My grandma was on hormones. So I'm in menopause. Where are my hormones? And I'm like, do you need them? Like, what are you experiencing? Is it bad? Can you get through all of the things you need to get through? And people are like, oh yeah, I'm fine. Everyone says you need hormones. No, the people who need hormones are women who are having symptoms that are disrupting their life. If your symptoms are bothersome, but you are able to get through life okay, you don't necessarily need these. So I think we just need to make sure that we have all the options on the table. We choose the option that works best for us. And if you feel like you're not getting all the options from your person, maybe it's time to choose different people.
That part, I love that. You just freed a whole bunch of people. You just freed a whole bunch of people. They're like, oh, I can change. I can.
Oh, yeah. Yeah. So
free yourself.
Ooh, yeah.
Free yourself.
So there is nothing wrong. And I say this when I talk a lot about medicine and different health problems when it's related to women's health. There is nothing wrong with you getting second, third, fourth, fifth opinions, right? Like there's nothing wrong with that. If you are not hearing the things that you feel comfortable with or the things that you think you should be hearing, then ask to talk to somebody else. There are thousands of us, right? It may be, depending on where you live and depending on kind of how your insurance is set up, it might be difficult to get that, but you should never do something, take something, be involved with something that you are not comfortable with. Until you get comfortable, we shouldn't be doing things. And I think it's becoming more of a trend now as people have become more confident in asking questions, become more, what is the word I'm looking for? Just more able to advocate for themselves. People are just a little bit more like, no, explain to me why we're doing this.
Right.
I think that's more commonplace now. But back in the day, my mom would go to the doctor and they'd be like, I'll take this. She's like, okay.
Yeah. I definitely see that. I feel like we could go on forever and ever. We might need to have a part 2 because we didn't even really dive into all your like quirky sexual health stuff. And I really wanted to talk about that. But let us know, guys, if you want a part 2, please let us know. If you're watching on YouTube, leave it in the comments. Or if you're following either of us on IG, send us a DM, leave us a comment, let us know. But before we wrap up, I want you to tell us what you have going on. I've heard you mention a menopause class or something like that. So tell us a little bit about what you have coming up.
So currently right now, so where I work currently, which is a large HMO in Southern California, I teach sexual health classes. I'm in the process of trying to transition those to the community because I do think it's important for everybody to have access to this kind of information. So once that happens and I have a location and all that, I'll put that on my IG and my website. But right now, where you can find a lot of the information I post about menopause, sexual health, and kind of all things reproductive health is my IG, which is which is Dr. Erika Simpson, if I can talk. On my IG, my website is linked there, which has blog posts and things like that on it. The other thing that's coming up that I think is really exciting is I'm part of a podcast called This Is Sex. I do that podcast with 2 other sex educators who are amazing. Valen Alford, who's a social worker by training, but sex therapist now. And then Jennifer Scott, who has a PhD and is sexual education, and she does like adolescent health. I mean, they're both amazing. We have very, very frank conversations about all things sexual health, things that are going on in the media, things like that. We took a break for a little bit and doing episodes because of all kinds of crazy personal, family, and health stuff going on. But we're actually planning a live event soon where we're doing things in person because now I won't say COVID's over, but the things are a little bit less restrictive now. We really want to do a live event to engage. So I'll have that on my IG as well. So
awesome.
Just keep an eye on the IG. Things are happening.
Keep an eye on the IG. And let me tell you, Dr. Erika is on there. And when you're looking for her, Erika with a K, make sure you look at Erika with a K.
Yes. Not a C. My best friend's name is spelled with a C, and we always argue which one is phonetically correct. Mine is correct. So.
Well, yes, make sure that you guys check out Dr. Erika. Thank you so much for taking a little bit of time to chat with us. Like I said, I would love for you to come back and do a part 2 if your audience and my audience are up for it. Thank you guys so much for listening to this week's this week's episode of Worth the Wait. Remember, remember, if this episode or any of our episodes have helped you, please do leave us a 5-star review, and you can check the show notes for any information on Dr. Erika. I'll talk to you guys next time. Bye.